Take note of these heart attack signs 30 days before it happens. Imagine having the ability to foresee a life-altering event before it happens. What if I told you that your body might be signaling the onset of a heart attack up to a month in advance? While it's easy to think of heart attacks as sudden, dramatic events, the truth is that your heart sends subtle warnings that can appear up to 30 days before the event. In today's video, we'll explore 7 early signs that could predict a heart attack. Stay tuned because knowing these signs could save your life. Don't forget to like, share, comment, and subscribe to this channel. It's a common myth that heart attacks come out of nowhere without any warning. The truth is, our bodies often send out signs long before the event actually happens. These signs may not always be dramatic or easy to recognize, but they are there. The key is to understand them, take them seriously, and act before the situation escalates to a full-blown heart attack. Whether you're at risk due to a family history of heart disease, high cholesterol, or lifestyle factors, knowing what to look out for could be a game changer. In this video, we're going to uncover 7 life-saving signs of heart attack that could appear up to 30 days before the event. If you notice any of these warning signals, it's time to take action. Let's dive in. Number 1. Unusual fatigue. Fatigue is something that we all experience at some point, whether it's after a long day at work or a sleepless night. We all know what it's like to feel tired. However, there is a type of fatigue that goes beyond the usual. This unusual fatigue is a deep, persistent exhaustion that doesn't go away with rest, and it can be a major warning sign that something more serious is brewing in your body, such as a heart attack. You might wake up feeling as though you haven't slept at all, even after a full night's rest. Or perhaps you find yourself overwhelmed by an intense wave of tiredness that makes even simple tasks feel impossible. This fatigue isn't just about feeling tired after a busy day. It's a more profound kind of exhaustion that seems to appear for no apparent reason. So why does this happen? When your heart is struggling to pump blood efficiently, it has to work harder. This extra strain can cause your body to feel drained, leading to that unusual fatigue. It's your heart's way of signaling that something isn't quite right. If you're experiencing fatigue that doesn't seem to match your level of activity, don't ignore it. It could be a clue that your heart needs attention. By recognizing this symptom early, you can take action before the situation worsens. Number 2. Chest discomfort. Chest discomfort is one of the most well-known signs of a heart attack, but it doesn't always present in the way most people expect. We tend to imagine a heart attack as an intense, sudden pain in the chest, like the dramatic scenes we see in movies. However, in reality, chest discomfort can be more subtle. It may feel like pressure, a squeezing sensation, or even a dull ache. For some people, it can even be mistaken for something less serious like indigestion or muscle strain. Imagine feeling as though a heavy weight is placed on your chest, making it hard to breathe, or experiencing a tightness that wraps around your rib cage. In some cases, this discomfort might be mild, and you might think it's nothing to worry about, but if the sensation persists for several minutes or is accompanied by other symptoms like shortness of breath, it should raise a red flag. Why does chest discomfort occur? It's often a sign that your heart isn't getting enough oxygen-rich blood. Blockages in the coronary arteries, which supply blood to the heart muscle, can lead to this discomfort. If left untreated, this oxygen deprivation can lead to heart muscle damage, resulting in a heart attack. If you experience any unexplained chest discomfort, especially if it's persistent or worsens over time, don't ignore it. Prompt medical attention can make all the difference in preventing heart attack or reducing the severity of the damage. Number 3. Shortness of breath. Shortness of breath is another subtle but important warning sign of a potential heart attack. Have you ever found yourself gasping for air after doing something simple like walking across the room or tying your shoes? You might feel winded for no apparent reason, or perhaps you're suddenly struggling to catch your breath even though you haven't exerted yourself at all. When this happens without a clear cause, It could be a sign that your heart is in distress. Why does this happen? The heart and lungs are deeply connected, working together to circulate oxygen throughout your body. When the heart is struggling due to a blockage or weakened muscle, it can lead to a backup of fluid in the lungs. This condition is called pulmonary edema and makes it hard for the lungs to expand fully, causing breathlessness. If you feel breathless during everyday activities, especially if it's paired with fatigue, chest discomfort, or dizziness, it's time to pay attention. Shortness of breath isn't something you should brush off, especially if it's occurring without physical exertion. It could be an early warning sign of heart trouble, and it's essential to seek medical help. Number 4. Indigestion or nausea. Indigestion, nausea, and even vomiting are common complaints that many of us experience from time to time. We might chalk it up to overeating, stress, or even stomach bug. However, in some cases, these gastrointestinal issues can be a subtle sign of a heart attack, especially if they occur alongside other symptoms like chest discomfort or shortness of breath. So why does a heart attack cause these stomach symptoms? The explanation lies in the way the body's nervous system works. The heart and stomach share common nerve pathways, and when the heart is under stress due to a lack of oxygen, it can send distress signals that affect the stomach. This can result in symptoms like nausea or indigestion. It's important to remember that these symptoms may be more common in women, the elderly, or people with diabetes, who might not experience these classic heart attack signs like chest pain. If you're feeling nauseous, experiencing indigestion, or vomiting without a clear cause, especially when combined with other symptoms of heart distress, take it seriously. Don't wait for the situation to worsen. Seek medical help as soon as possible. Number 5. Jaw pain or throat pain. One of the lesser-known signs of a heart attack is pain or discomfort in the jaw or throat. While this symptom is not as commonly recognized, it can be just as important. You might experience a dull squeezing pain in the jaw or a feeling of tightness in the throat. This referred pain happens because the nerves from the start and those from the jaw or throat share similar pathways to the brain. So when your heart is in distress, the pain can be felt in these distant areas. Jaw pain can be particularly confusing because it's often mistaken for a dental issue, a toothache, or even an ear infection. Throat pain can be also misunderstood as a sore throat. But if this pain is accompanied by other symptoms of a heart attack, such as chest discomfort or shortness of breath, it's crucial to seek immediate medical attention. If you experience jaw or throat pain, especially without any obvious cause, pay attention to other possible signs of a heart attack. It's always better to err on the side of caution, as this could be a critical clue to a heart in distress. Number 6. Lightheadedness or dizziness. Feeling lightheaded or dizzy is another symptom that can easily be dismissed, especially if it occurs after standing up quickly or during a hot day. However, if dizziness or lightheadedness occurs frequently or without an obvious cause, it could be a sign that your heart isn't pumping blood efficiently. When blood flow is restricted due to a heart issue, it can cause a drop in blood pressure, which leads to a feeling of faintness or dizziness. This symptom is particularly dangerous because it can lead to fainting, which is a serious sign that your body is not receiving enough blood or oxygen. If you feel dizzy or lightheaded, and especially if it's combined with other heart-related symptoms, don't ignore it. It's your body's way of telling you that something is wrong with your heart. If you experience these symptoms, seek medical attention immediately. The earlier you act, the better your chances of avoiding more severe health complications. Number 7. Cold sweats or excessive sweating. Sweating is something we all experience, whether it's due to physical exertion, a hot day, or even stress. However, when sweating happens for no apparent reason, particularly if it feels cold and clammy, it could be a sign that something more serious is happening in your body. Cold sweats, especially when they occur alongside other symptoms like chest discomfort or shortness of breath, can indicate a heart in distress. When your heart is deprived of oxygen, It triggers a stress response in the body. And one of the ways your body responds is by sweating. This kind of sweating can feel very different from the sweat you experience after exercise. It's cold, clammy, and feels like your body is in a state of panic. If you experience cold sweats without a clear cause, especially if they are combined with other heart attack symptoms, it's time to take action. Don't wait for things to get worse. Seek medical attention as soon as possible. Thanks for watching, everyone. If you've had a personal experience with a heart attack or have any questions, please leave a comment below. If you want to learn more about heart health, be sure to check out our next video on the top foods to eat for a healthy heart.